Hi, welcome to my message from the board. Just an update on what's hot and what's going on across the Trust. We were beautifully hosted at Wathwood Medium Secure Unit for the board meeting in July, and we were well looked after, and it's a great opportunity to meet some of the staff that work there and providing great services. And it's good for the board to get out, and I know that sometimes we can feel we're a bit constrained in headquarters in Nottingham. The board always starts with a patient story. We had a fantastic presentation from one of our adult mental health patients who really had been through the mill and had really significant psychological challenges, which resulted in an admission to our wards, and a subsequent, though, a fantastic recovery. And she is now helping as a volunteer and really contributing to helping others get to a place of recovery. And it was really inspiring to hear her story. That linked into the next piece of the ball, which was a piece that I think is gaining momentum, and that's the staff voice and hearing directly from staff their experiences of working in the Trust. And again, a number of staff from adult mental health presented a range of challenges they face, which are familiar to us all, not least in terms of staffing wards, staffing teams, the challenges of increasing demand and working in a really difficult NHS and social care environment. But it was heartening to hear some of the positives and what great work they're doing and how things are starting to move forward. In relation to adult mental health, just a brief update on some of the things we're doing around meeting the challenge of out-of-area placements. So we're hoping to get what's catchingly called the Psychiatric Clinical Decisions Unit open on the Highbury site, which will be a facility to enable an extended assessment of people and hopefully provide an alternative to admission and the chance to set up some crisis intervention and a more properly planned home treatments pathway that can help people stay in their local communities and at home. We spoke in quite some detail about something called the Interim People Plan, which is a national publication as a prelude to the full plan, which is coming out later in the year. Why is this important? This is critical to how we're tackling the tremendous challenges we have around staffing and ensuring that we can support and develop our staff to be the best they can be. There are massive national challenges, and we're obviously not immune to them. The key part about the interim plan is that we have already set up a tremendous amount of work addressing exactly the sorts of things that they're identifying. So, for example, the work around the culture and values and behaviours that we started, our improved offer around leadership, and our work around the health and wellbeing services that we can provide for our staff, are all integral to how we can move forward. We're having a large amount of engagement, focus groups, one-to-ones, meetings across the summer and autumn, and we'll start to draw that together at the end of those to, I think, provide what's a really exciting co-produced piece of work that move us forward around all things to do with our great staff. Last piece, just wanted to give some brief details around something called new care models, which is, again, an emerging national priority. And this is why this is important. It's quite a significant change in the landscape of how services are commissioned and provided. We've got a tremendous opportunity at Notts Healthcare to become the lead provider across the East Midlands for a large range of forensic services, and will introduce the concept to the Trust of being a lead provider and overseeing an amount of commissioning which is obviously new. There's a lot of energy and resource nationally around supporting this, but again, it's a real opportunity for us to get into new environments and to improve both the quality and the efficiency of services that are run. One of the big challenges is how we maintain this within what's a traditional provider trust. So there's lots of quite technical governance work around how we set this up, but it's a really exciting opportunity for us, and we'll be communicating more about it through the year. So it's a very brief resume of what was a long and detailed board, lots of business, and I wanted to sign off by wishing you a happy summer. Despite the current weather, hope you find time to take a break with family, friends and loved ones. It's really important that we get an opportunity to recharge, reflect and refresh, and come back fully charged for what's going to continue to be a busy year. Thanks very much.